Welcome to This Week in Neurosurgery. This week we're covering 10 notable papers spanning neurovascular innovations, updates in the management of complex brain tumors, and new approaches in pediatric and diagnostic neurosurgery. Let's dive in. In cerebrovascular care this week, we see parallel efforts to refine both endovascular and open surgical treatments for intracranial aneurysms. A large multi-center registry from Italy evaluated the newer generation Surpass Evolve flow diverter in 275 aneurysms. In this real-world cohort, the device demonstrated a high safety and efficacy profile, achieving complete or near-complete occlusion in 92% of aneurysms at long-term follow-up, with a low device-related mortality of 0.7% and morbidity of 5.4%. The authors conclude its performance is substantially equivalent to other commonly used flow diverters. While endovascular techniques advance, a prospective trial in the Journal of Neurosurgery demonstrates that significant gains are still possible in perioperative care for open clipping. In a study of 414 patients undergoing elective clipping for unruptured aneurysms, the implementation of an enhanced recovery after surgery, or ERAS protocol, was associated with significantly lower postoperative pain scores, markedly decreased opioid use, and a lower incidence of nausea and vomiting. Importantly, patient-reported recovery quality was higher in the ERAS group, while hospital stay and complication rates remained comparable, supporting the feasibility and benefit of ERAS in craniotomy surgery. Moving to acute ischemic stroke, a large real-world registry analysis in the Journal of Clinical Neuroscience evaluates the modern role of a direct aspiration first-pass technique, or ADAPT. This multicenter analysis compared ADAPT using contemporary large-bore catheters against combined techniques in over 1,000 patients. After propensity score matching, the study found no statistically significant difference in 90-day functional independence between the two groups. However, the ADAPT strategy was associated with significantly higher rates of complete reperfusion, both on the first pass and at the end of the procedure, and achieved this with a shorter puncture-to recanalization time. These findings support ADAPT as a reasonable and highly efficient first-line strategy for mechanical thrombectomy. And for surgeons performing bypass surgery, particularly for Moyamoya disease, a detailed anatomical study in the Journal of Neurosurgery provides crucial guidance for preserving the middle meningeal artery. Recognizing that the MMA often serves as a critical collateral pathway, this study analyzed its course within bony canals, in both dry skulls and patient CT scans. A key clinical finding was that in patients with Moyamoya disease, these bony canals were significantly longer and wider compared to those with atherosclerotic disease. The authors note that after fontanelle closure, the canal is very likely to be found within 1 thumb's width posterior to the pterion, providing a critical landmark for vessel-sparing craniotomies. In neuro-oncology, we have updates ranging from fundamental molecular targets to long-term surgical strategies and survivorship. A report in the Journal of Neuro-Oncology identifies a potential new therapeutic avenue for gliomas by targeting VMP5. Through integrative analyses, researchers found that VAMP5 knockdown suppresses the PLK1 pathway, thereby inhibiting tumor cell proliferation in a specific subset of gliomas. They also identified that high expression of another protein, NDRG4, predicted sensitivity to this approach, providing a potential pharmacodynamic marker and a preliminary mechanistic framework for a new targeted therapy. 2 papers address the management of rare but formidable tumors. For patients with NF2-related schwannomatosis facing giant skull-base collision tumors, a study in the Journal of Neuro-Oncology assessed the long-term outcomes of a function-preserving surgical strategy. In a cohort of 13 patients with tumors averaging 5 centimeters, a strategy of planned, selective resection accepting residual disease to preserve neurological function yielded a median reoperation-free survival of 6.1 years and an 88% overall survival at 10 years. This supports the feasibility of this longitudinal management approach in a young, heavily pretreated population. Meanwhile, a systematic review in World Neurosurgery provides a comprehensive look at the rare but aggressive phenomenon of malignant transformation in intracranial epidermoid tumors. Based on 68 published cases, the review confirms that this transformation is associated with rapid growth and new contrast enhancement, and it highlights characteristic imaging changes termed loss of fluidity and the flip sign. The prognosis is poor, with a median overall survival of just 23 months. Reinforcing that maximal safe resection remains the cornerstone of management. Finally, turning to survivorship, a study in the Journal of Neurosurgery, Pediatrics reminds us that even for so-called benign tumors, the journey is not over after surgery. This study evaluated 66 pediatric patients with low-grade CNS tumors treated with surgery alone. Years after their operation, these children reported significantly lower quality of life scores compared to healthy peers, with over half experiencing difficulty with school-related functioning. A notable proportion also met criteria for at-risk anxiety or attention difficulties. The clinical implication is clear. Routine psychosocial assessment should be an integral part of long-term neurosurgical follow-up for this population. Rounding out the week, we have 2 papers on pediatric neurosurgery and diagnostics. Also in the Journal of Neurosurgery Pediatrics, a retrospective study evaluates the use of rapid spine MRI to avoid sedation in children. In a cohort of 788 patients, those who received a rapid MRI were younger. While these patients did require more subsequent imaging compared to those who had a regular MRI initially, they also underwent fewer surgical interventions. The study identified that lower body mass index, developmental delays, and leg weakness were predictors of needing further imaging after a rapid scan. This helps clinicians better select patients for whom a rapid sedation-free MRI will likely be sufficient first-line imaging. And in World Neurosurgery, a study explores the utility of CSF metagenomic next-generation sequencing, or MNGS, in managing post-infectious hydrocephalus. In a retrospective cohort of 42 patients, using MNGS to confirm clearance of infection before shunt placement was compared to standard methods. The MNGS group had a significantly shorter time from the first negative CSF culture to shunt surgery, a median of 3 days versus 9 days, and a shorter time from the decision to shunt to the actual operation. This acceleration was achieved without any difference in outcomes like infection, recurrence, or reoperation, suggesting MNGS is a safe and feasible tool to expedite definitive treatment. If you only have time for one paper this week, make it the study on enhanced recovery after surgery for aneurysm clipping from the Journal of Neurosurgery. It's a powerful prospective demonstration that focusing on systematic perioperative care, from education and fasting to non-opioid pain control, can yield significant improvements in patient comfort and recovery, and it provides a practical framework that can be adopted by any cranial surgery team. Here are the key takeaways from this week in neurosurgery. First, for unruptured aneurysm clipping, implementing a formal erase protocol can significantly improve postoperative pain, reduce nausea, and enhance overall recovery quality without increasing complications. Second, in modern stroke thrombectomy, a direct aspiration first-pass technique with large bore catheters is a highly efficient first-line strategy, achieving faster and more complete reperfusion, though functional outcomes were similar to combined techniques in a matched analysis. Third, children treated for low-grade CNS tumors with surgery alone face significant long-term quality of life and mental health challenges, underscoring the need for routine psychosocial screening in neurosurgery follow-up clinics. Fourth, in managing post-infectious hydrocephalus, using pre-shunt CSF MNGS can safely accelerate the timing of VP shunt placement by providing earlier confidence that the infection is cleared. And finally, for giant complex skull-based tumors in NF2 patients, a strategy of planned selective resection that prioritizes neurological function can provide durable tumor control with a median reoperation-free interval of over 6 years. That's your roundup for this week in neurosurgery. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.